We're doing case reviews. So this is advanced level, sort of high-end senior students, practitioners coming in with the challenges that they see in clinic, the weird and wonderful things that they see in clinic, things that we're stuck on, things that we want to share that we've had great success with. So there'll be a whole piece of round table collaborative work where you and I are facilitating and our participants are sharing their, again, challenges and successes and collaborating together to come up with programs for real-time patients. And then we're going to have some afternoon lectures from yourself and me. So let me ask you, David, what it is that you're going to be bringing this time to our advanced case studies herb camp.
I'm going to be doing an advanced class on alternatives, which is a really important, but again, little understood group of herbs. So that is going to be one of the classes I'll be doing. And then the other class that I'm really excited to offer is a class on differential diagnostics for herbalists. And this is something that a lot of my students, and certainly in my 2-year program, we do this, but we're going to go beyond that because this is going to be kind of one-on-one. We've limited this to a small number of people so that everybody has time, and we're going to get to really look at diagnostics in a way that helps people to understand just what they can glean. Instead of treating the disease, we're going to be looking at ways to learn to treat the person. Because in my opinion, if somebody wants to be a great herbalist, and so, last time and this time, I'm hopeful that the people we get many of them are advanced practitioners already. These are people, they may be beginning practitioners, and that's perfectly fine, or advanced students, but also we had some really advanced students. And the idea is, I know you've been in clinical practice for many decades. I've been in clinical practice for 47 years. And what really helps us to get to that next level is to understand how you can look at a person, whether we're doing things like facial analysis, TCM, tongue diagnosis, physical diagnosis, functional blood work, which I use a lot of. We're going to be talking all about all of these things and doing them, and then looking at applying to the cases that we're actually doing. And so to me, that's really exciting because this is a topic that doesn't get taught much in the herbal community. And let me just say that when it is taught, I'm often somewhat disappointed about what's out there. It doesn't go deep enough. It's often very surface things. And here we're going to really be looking at that on an in-depth level with significant handouts and, again, experience so people can actually, we're going to have people looking at tongues, not just slides, but looking at the tongues. We can look at each other's tongues and say, well, okay, this is what you're actually seeing. And that's one of the things that is often missing, because it's one thing to look at a picture in a book. It's another thing to have somebody who's experienced saying, this is actually what we're seeing there. And this relates back to this pattern or this condition or whatever. And so for me, it's really exciting because we get to do, again, this sort of almost one-on-one level, lots of time for Q&A, for questions, again, going back and forth with the cases, and then you're going to be presenting your cancer care work. I just think that any practitioner or advanced level student who takes this class is going to come out of this with not only a lot of information, but skills that they're going to be able to put into practice with their patients immediately.
Thank you for saying all of that. I think you're so right. The diagnosis, we're often taught that we're not allowed to make a diagnosis and therefore don't bother learning all those skills. And then you come to clinic and it's like your patient presents with something that the doctors don't know what to do with. We're obligated to try to understand it and then maybe don't have that skill set. So I think what you're going to be teaching is absolutely critical information for any practitioner. So again, we're going to review cases in the morning, the cases our students bring into the program. And then in the afternoon, you're going to talk about alteratives. You're going to talk about differential diagnosis. I'm going to talk about cancer care. And we'll be trying to weave that back into those case reviews, depending on what those cases are, of course. And then the grand finale, we're going to have a very fun last afternoon of you and I collaborating on a herb walk in my botanical garden. And of course, all of our students are also also herbalists, so I'm sure they'll have lots to share about that as well. So I think we're going to have a lot of fun. We certainly had a lot of fun when we did this before, but we also covered a lot of ground and learned a great deal. And I've absolutely heard from those past students about how valuable the week was, how deep we were able to go, and how applicable and practical that information had been for them. In fact, we have a couple of those students coming back again because they got so much out of it that they want to come again. So I'm really, really excited that you're coming back to Vancouver Island. We're going to have a fabulous time. We do still have a few spaces open. It is a small class by intention, but we do have a few spaces still open. So I'm hoping that we will fill those with wonderful students who bring challenging cases for us all to dig deep into. And I thank you so much for being willing to travel far from home to come and share your knowledge. And yes, between us, we have over 80 years of clinical practice. That's a bit scary, actually, isn't it? But hopefully something that we can share with others, something that our hard work and years of effort can help others along the way. So delighted to welcome you back to Vancouver Island and looking forward to a fantastic week. July 29th to August 2nd, and it's going to be fun.
Well, I can't wait to be there. I had a great time last time. I will guarantee everyone you will be incredibly well fed with really healthy food. The farm is absolutely gorgeous. I am really looking forward to it. And I will just say that even though we've kind of told you what the plan is, what we're going to do, and we will do all of that, then there's the other stuff. Then there's the thing that comes up in conversation that you weren't even planning to do, and you just go off into a whole nother level. And that's the beautiful thing about it, is there's the time to do it.
Yeah, and the collaborative learning, because everybody comes in with great knowledge and value to share, and so we all learn from each other, and that's exciting for us as well.
Absolutely.
So thank you again, David. I will see you very soon, and I'm really looking forward to it.
I am as well. Thank you.